Good morning, Gamecocks. I'm Amanda Leslie reporting to you live from Medicine's Hospice Care to provide you the scoop on the 10 competencies and how I've incorporated them into my field placement. Let's take a walk into my office and get this started. All right, everybody, welcome back. I am now in my office ready to give you the scoop on the 10 competencies and how I have applied them at my field placement at Medicine's. So the first competency is identifying yourself as a professional social worker and conducting yourself in that manner. So on a daily basis when I'm there, I will be in business casual with a nice shirt and some dress slacks, or when we're interacting more with patients instead of office work, we are allowed to wear scrubs. So the second competency is applying social work ethic principles to guide professional practice. So in this instance, it's like being able to recognize your personal values and managing them to allow yourself to go out and be professional and using that as a guidance. So I have written down that I've referred to the code of ethics a few times on what I'm supposed to do professionally without allowing my personal views and opinions to get in the way of that judgment. So the third competency is applying critical thinking to inform and communicate professional judgments. So in this instance, supervision is a big one, being able to talk to my field instructor about any concerns or getting feedback and being able to apply that to the future. So when we go see patients, we always reflect on what we noticed, what we didn't notice, and get that feedback. So that's a way to communicate. And the fourth competency is engage in diversity and difference in practice. So this is basically being aware of your personal biases and eliminating them to be able to conduct yourself professionally. So when I go into a patient's home or their nursing home or wherever their residence is, I put my personal biases to the side and I'm able to engage with them and provide the services that they need. But I also use those situations to be aware of that and grow from it. So the fifth competency is advance human rights and social economic justice. So an instance of this is we do what we call tuck calls to patients, and we ask them what their needs are for that present time, if there's any questions or concerns to pass on to the proper channels. So in that manner, we're advocating for them because they might not necessarily feel comfortable calling the office, even though that is something they are told to do without hesitation. They still are apprehensive. The sixth competency is engage in research-informed practice and practice-informed research. So an example that I wrote down was I attended what we called Coping with the Holidays with the bereavement coordinator to give tools and advice to patients, loved ones, and friends on how to cope through the upcoming holidays. And I was able to gauge the difference in how people are coping and handling that might have lost their loved one earlier or a few years ago even versus currently, and the differences there. The seventh competency is applying knowledge of human behavior and social environment. So this is the use of all the tools and theories that we learn in HIPSI and diversity, and allowing yourself to understand maybe someone's perspective on hospice as a whole from previous experiences with it or lack of knowledge about it, and their judgments on what services they do or don't want, along with, any concerns from hearing things through the grapevine. So you're able to go into their environment, see what's going on presently, and how their past may be affecting or not affecting their care. The eighth competency is engage in policy practice to advance social and economic well-being to deliver social work services. So in this instance, there might be patients that don't qualify for certain resources or care that they're needing through Medicare because they make too much money. So if that's the case, then the organization will come up with other options, to provide the care that they need. So you're advocating and speaking to the insurance companies to see what maybe the problem is. Number 9 for the 9th competency is respond to contexts that shape practice. So I had a harder time coming up with an example of this, but it talks about like providing leadership and promoting sustainable changes in service delivery and practice to improve the quality of social work services. So something that I personally have done is being willing to take on tasks that I can do on my own and providing the services that is needed that my task supervisor or my field instructor have given me, and staying in my internship lane and following up with them. So it's, being independent and showing the ability to lead. The 10th competency is engage, assess, intervene, evaluate with individuals, families, groups, organizations, and the community. So this is an endless topic. One thing that I have done is I went to a memorial service for all the patients that I've passed this year that Competencies does annually. So you're engaging with the bereaved. And I also went to a veterans golf tournament, and provided breakfast with Competencies. So you're engaging with the community. Also, it speaks about facilitating the transition and ending. So of course with hospice, it's when the patient dies, but the bereavement coordinator works with the families for up to a year to 13 months after. So that's just a way of intervening and being involved in the community. So I'm sure there's a lot more things that I've done for each one of the competencies that I'm just not able to think of at the moment. But I hope you all got the gist of what I was trying to incorporate and that it wasn't too bad. So you all have a good day.